pregnancy is typically divided into 3 equal trimesters. While the first 2 trimesters may come with some basic difficulties, the 3rd trimester tends to be the most challenging. At this point, you may feel both physically and emotionally heavy, as your baby is fully grown and preparing to enter the world. This can bring about a host of emotional concerns, as you contemplate the upcoming delivery and all the potential complications that may arise, which you may have heard about from friends or family. This is an important topic for expectant mothers to understand, as it can help them recognize potential complications and seek medical attention promptly. Let's dive into some of the most common complications. To help us grow our channel and reach more people, we kindly request that you like, share, and subscribe to our content. Placenta Previa. Placenta previa is a complication that can occur during pregnancy when the placenta is positioned low in the uterus and partially or completely covers the cervix. This can lead to bleeding, which can be dangerous for both the mother and baby. The exact cause of placenta previa is not known, but it is more common in women who have had previous pregnancies, have had a C-section, are over the age of 35, or have uterine abnormalities. In some cases, medication or a blood transfusion may be necessary, and in severe cases, delivery by C-section may be required. It's important to be aware of the signs and symptoms of placenta previa, which can include painless vaginal bleeding, cramping, and contractions. Fetal distress. Fetal distress is a complication that can occur during pregnancy when the fetus is not getting enough oxygen or nutrients. This can be caused by a variety of factors, such as placental problems, umbilical cord issues, or maternal health conditions. In some cases, delivery may be necessary to ensure the safety of both the mother and baby. It's important to be aware of the signs and symptoms of fetal distress, which can include decreased fetal movement, an abnormal fetal heart rate, and meconium in the amniotic fluid. Premature rupture of membranes, PROM. During pregnancy, when the amniotic sac, which contains the baby and amniotic fluid, breaks before the onset of labor. This can increase the risk of infection and other complications for both the mother and baby. It's important to be aware of the signs and symptoms of PROM, which can include a sudden gush or trickle of fluid from the vagina, a continuous trickle of fluid, and a feeling of wetness in the vaginal area. The exact cause of PROM is not known, but it is more common in women who have had previous pregnancies, have had infections during pregnancy, or have had certain medical procedures. You should also avoid taking baths or using pools or hot tubs, as these can also increase the risk of infection. Placental abruption. Placental abruption is a complication that can occur during pregnancy when the placenta separates from the uterus before the baby is born. This can cause bleeding and other complications for both the mother and baby. The exact cause of placental abruption is not known, but it is more common in women who have high blood pressure, smoke cigarettes, use cocaine or other drugs, have experienced trauma to the abdomen, or have had a previous placental abruption. Important to be aware of the signs and symptoms of placental abruption, which can include vaginal bleeding, abdominal pain or tenderness, back pain, and contractions that are more frequent or intense than usual. Intrauterine growth restriction, IUGR. Intrauterine growth restriction, IUGR, is a condition in which a baby in the womb is not growing at a normal rate. The reason behind IUGR can be complex and often multifactorial. However, some common factors that can lead to IUGR include maternal smoking, alcohol or drug use, infections, high blood pressure, preeclampsia, placental abnormalities, and poor nutrition. It is important to diagnose and manage a UCR as it can lead to serious complications such as preterm birth, low birth weight, hypoxia, and developmental delays. It is important to maintain a healthy lifestyle during pregnancy, including regular prenatal care, a healthy diet, and avoiding alcohol and tobacco use. Preterm labor. Preterm labor is a complication that can occur during the 9th month of pregnancy before the 37th week of gestation. It refers to when the uterus begins to contract and the cervix begins to open before the baby is fully developed. This can lead to premature birth, which can increase the risk of complications for the baby. The reasons for preterm labor are not always clear, but some factors that can increase the risk include infections, a weakened cervix, or problems with the placenta. If you are experiencing preterm labor, you should lie on your left side to help improve blood flow to the uterus and avoid sexual activity, which can cause contractions. You should also avoid lifting heavy objects and reduce your overall physical activity. If you are experiencing any symptoms of preterm labor, such as regular contractions, pelvic pressure, or lower back pain, contact your healthcare provider immediately. Preeclampsia. Preeclampsia is a pregnancy complication that typically develops after the 20th week of gestation, but can occur during the 9th month of pregnancy. It is characterized by high blood pressure and protein in the urine, and can lead to serious complications for both the mother and baby if left untreated. The exact cause of preeclampsia is not known, but some factors that can increase the risk include a history of high blood pressure or preeclampsia in a previous pregnancy, obesity, and certain medical conditions such as diabetes or kidney disease. Your healthcare provider may recommend frequent monitoring of your blood pressure and urine, bed rest, or medications to help lower your blood pressure. In severe cases, early delivery may be necessary to protect the health of both the mother and baby. It's important to be aware of the signs and symptoms of preeclampsia, which can include high blood pressure, protein in the urine, swelling of the hands and face, headaches, and visual disturbances. You should get plenty of rest and avoid physical exertion. You should also eat a healthy diet and avoid salty foods, which can increase blood pressure. Gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy, typically during the 2nd or 3rd trimester. It occurs when the body is unable to produce enough insulin to regulate blood sugar levels during pregnancy. Women who are overweight, have a family history of diabetes, or are over the age of 35 are at a higher risk for developing gestational diabetes. It's important to be aware of the signs and symptoms of gestational diabetes, which can include excessive thirst, frequent urination, fatigue, and blurred vision. Follow your healthcare provider's recommendations for monitoring your blood sugar levels and taking any prescribed medications. You should also eat a healthy diet that is low in sugar and high in fiber, and engage in regular physical activity. On the other hand, you should not skip meals or eat large amounts of sugar, as this can cause your blood sugar levels to spike. Postterm pregnancy. Postterm pregnancy is a condition where a pregnancy lasts beyond 42 weeks of gestation. The normal duration of pregnancy is between 37 and 42 weeks. A postterm pregnancy can lead to complications for both the mother and the baby. The exact reason behind postterm pregnancy is not known, but it may be due to inaccurate due date calculations or a problem with the placenta. The risks associated with a postterm pregnancy include an increased risk of stillbirth, meconium aspiration, fetal distress, and difficulty during delivery. If a woman is still pregnant after 42 weeks, her healthcare provider may recommend induction of labor. This may involve using medication to stimulate contractions or manually breaking the water bag surrounding the baby. If you experience any of these complications or have concerns about your pregnancy, it is important to seek medical attention promptly. Subscribing to our channel is the best way to stay up to date on our latest content and receive notifications when new videos are